Go.
This is Dr. Jeff Epstein from Miami, joined by Marty, my star assistant. I'm giving a tip. Actually, this is going to be 2 tips in 1. And this is on a technique I utilize for achieving maximum density. And it's a pretty simple tip, but it's something I've started doing over the last few years, and it really has made a difference. And it's a matter of changing your perspective when you're doing a transplant from the side sitting versus coming up from above. And I'm going to demonstrate that. One other tip, you got a bonus tip out of this little presentation. Patients sometimes develop pink scalp, especially these patients who are of Northern European, Irish particularly, ethnicity, and they develop pink. Their scalp gets very pink during the course of the procedure. And a little tip we use is giving the patient a Benadryl, diphenhydramine. Many times it helps reduce some of the pinkness. But let's get into this surgical tip. This is a patient, come a little closer, and this is a patient I did prior transplant on. This is prior transplant. So he doesn't have the thickest donor hairs, but I was able to achieve a nice improvement. But he's coming back today. He underwent a brow lift and elsewhere, endoscopic brow lift, so we're filling in the scars, but he's seeking to have his hairline brought back down. So I've already planted, we're doing around a little over 1,900 grafts on him in this to restore this frontal area. And we've already planted around 1,600 of the grafts, and now this is sort of the refinement. And this refinement is to achieve optimum density or maximal density. The way I'm going to do that, I've already made most of my recipient sites how I typically do using a 0.6 millimeter for my 2 hair grafts. And you see how I typically go ahead and I make my recipient sites, and it's a nice way to go ahead, and I can see all the little spaces. But now I want to go for maximal density. How am I going to do that? Because many times it looks like this is already filled optimally. Now this one is not, but there are cases where it's really packed in tightly, like right in this frontal areas where it's pretty tightly packed. And if I sit in the back, I may see a couple of spaces. If I go from the side, I may see a few spaces, but this is how I go ahead and I see where all the spaces are. Marty, can you raise the table up a bit? With me standing over the patient and looking on, thank you, at the angle at which the hairs are emerging gives me the least obstruction of where the open portions of the scalp are. So from that perspective, I'm now able to go ahead and see no hairs blocking me, no little pieces of scalp skin blocking me, and I'm able to achieve in that all-important area right here in this frontal central region, maximum density. So I have an unobstructed view, and I'm basically, other than he's got a little bit of bleeding, not surprising, but I'm able to go ahead and make these recipient sites having a nice view, unobstructed view of where the hairs are needed. So that's my tip number 1 and 1A, which is the Benadryl for redness. Anyway, this is Dr. Epstein. Thanks, Marty, for being a great assistant. Thank you.